Hey everybody, this is Trevor Pace from Pace West Physical Therapy coming at you. It's April 2nd, 2020. We're calling this week 3 of COVID pandemic here at Pace West Physical Therapy. You may not recognize me from my last video I shot because some things have changed. Can you guess? No, it's not the hair. I'll probably wind up with a ponytail by the time all this is said and done. And it's not the scrubs, although they're pretty cool. I like wearing them. They're like pajamas. If you guessed my beard, you're right. It's the first time I've shaved it in 3 years. The reason for that is twofold. One, it's more comfortable to wear a mask all day. Two, it performs better. There's a better barrier there between my skin and the mask. So there. And a caveat is some people say I look a little bit younger. Maybe on the television you can see that too. I hope so. I'll take it. Anyway, just got done with my day. I saw 3 telehealth patients. I saw 5 patients within the office here. We're sort of bumping along at that rate. We're functioning at about 40 to 50% of our normal capacity. We have Chris, Paul, Katie, Hannah, Joe, Darcy, all treating either in the office or at home virtually. We have 3 to 4 days that we're working here in the office, and that's by choice, just to keep the volume down, the exposure down here at the office. And I'm really here to share with you some of the latest updates about our profession of physical therapy, our operations here in the office, and to ask you a wee little favor. But first, let's get on to some business. On March 19, 2020, the U.S. Department of Homeland Security released a memorandum on the identification of essential critical infrastructure workers during the COVID-19 response. In it, they define the essential critical infrastructure workforce to include healthcare and public health professionals, more specifically caregivers, physicians, dentists, psychologists, and to that list they've added physical and occupational therapists. What this memorandum effectively means is that physical therapists are considered frontline medical providers during this pandemic. And we have to adhere to strict CDC guidelines and local government mandates in order to practice safely. So, in order for PTs to adhere to the guidelines, we are required to wear PPE, otherwise known as personal protective equipment, something you all are very familiar with at this point, and something that is in low supply across the nation, as you know. Well, here's where we ask you for that wee little favor. We need PPE. In order of importance, masks, gloves, and disinfectant wipes or solutions. Here we have some examples of masks that will work for us. Disposable accordion masks, PM 2.5 masks, or N95 or P95 masks. As for gloves, there are many types that will do. Polyurethane, latex, all-purpose nitrile, even prep food disposable vinyl gloves will work. Disinfectant wipes, sprays, and hand sanitizers from companies like Purell and Lysol is what we are requesting. Sorry about that. And lastly, all of our supplies are running low already, and we expect that we'll need them for months to come. Your donations are vital to our operations. If you have donations, please feel free to bring them in at your next appointment or to call our office to make other arrangements. From all of us here at Pace West Physical Therapy, be healthy, be well, and thank you so much for your ongoing support.